Hello, I'm Dr. Chakrageous, and today this is your daily dose of education. Namaste. We're going to start with anatomy and physiology. The topic of choice. Today, we're covering anatomical position. In humans, an anatomical position is defined as standing up straight with the body at rest. It describes the anatomy of the body so that it is easy to understand what part of the body is being talked about. No matter what direction the organism is facing or where its appendages, limbs, appendages, are, it describes different parts of moving organisms no matter how they are moving or what position they are in. Yes. So, we have sagittal planes that divide the body. Yes, we do. Our complex bodies have different verbiage to further identify in times of necessity. You don't necessarily have to work in the medical field to have pertinent knowledge relevant to your need, handy, due to self-care. So, a median sagittal plane is a vertical plane passing through the middle of the body. Okay? So, this is the median sagittal plane. Dividing it into equal right and left halves. Planes parallel to this plane are called sagittal and paramedian plane. Okay? So, you have the sagittal up and then equally splitting across. And you have the paramedian plane. So it's the representation of a four-way board. And you're going to stack this board up. Exactly like this, Okay? So we're going to make our planes. So you have what you would call, this is the representation. The paramedian and the median. So, exactly how it crosses. You see it from the side, it goes through, it intercedes, it intersects. Even on this side, it still crosses the paper. So imagine the human body in between this. These transverses and planes are used to describe the division necessary to properly communicate in the medical field. So, you have your median sagittal, which is your vertical plane passing through the middle of the body, dividing it into equal right and left halves, which creates the right and left half of the anatomical body. The paper that cut through, and you can see on both sides, that's the paramedian. It's the pair of median discs that are used to split that sagittal plane in order to create your upper and lower quadrants. Moving along. And it's okay to take notes. We'll call those formulas. Okay? I'll let you know when there's a formula to take. The coronal plane is the vertical plane at the right angle of the sagittal plane. Okay? That would be over here. After the body is divided into up, down, left, and right, this would be the coronal plane. It's the vertical plane at the right angle of the sagittal plane, okay? And it divides the body into anterior and posterior, which is the front and the back of the body. The horizontal or the transverse planes are at the right angles to both the sagittal and the coronal plane. The transverse would be what goes through the middle. Because it divides the body into upper and lower. That's the transverse plane. Yes, the coronal plane is the vertical plane at the right angle to the sagittal plane. So you have the sagittal, and then you have the coronal. No, you have the sagittal, and this will be the coronal, and here's the horizontal plane. So you have the transverse, and then you have the coronal, which is right here because this is the sagittal. Coronal is this quadrant. Superior and inferior. Superior, above. Inferior, below. Superior means near the head. Inferior means near the feet. Medial and lateral. Medial means near the middle line. Lateral means away from the middle line. So, is it medial? How close is the pain? Is it medial or is it lateral to your belly button? Anterior and posterior. Anterior, the front. Posterior, posterior. Behind, near the back of the body. Something that is in the past. And then anterior, that's how you remember, well, post, past. And that's how you remember as a context clue of a formula of how to identify. Sometimes the terminology in the medical field can be daunting. And you want to have tools to be able to verbalize your ability to say. Not everyone has to be in the medical field to know how to have healthy life skills. So let's utilize this tool to create this formula. Posterior. 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 That's near the back. Superficial and deep. Superficial means near the skin. Near the skin. Deep means away from the skin. So is the cut superficial or is it deep? If this is the skin and the breaking of the cut is just right here, it's superficial. If this is the skin and the cut, that's deep. Proximal means near the root of the limb. Proximal means near the root of the limb. So if this is the limb, is it proximal? If you say you have pain, is it proximal to the joint of the arm? Or is it near, almost the top of your elbow, making it distal? The palm of the hand and dorsum of the hand. The sole of the foot, plantar surface of the foot, or dorsum of the foot. So the dorsum, and that part in the bottom of the ball, if this is your foot, that part right there, it's called the dorsum. The dorsum. D-O-R-S-U-M. Dorsum. Formula moment. Flexion and extension. Flexion means bending, usually in most joints. Flexion is bending anteriorly. Posterior flexion, anterior flexion. Except in the knee joint, where flexion is bending posteriorly. Extension means straightening. Abduction and adduction. Ab, like your abs, duction, means to move away from the median plane. So to abduct is to take your arm further from the median center, which can be found anywhere from your sternum and near the umbilical region. So to abduct would be, I'm abducting. It's to take away your arm. To adduct is to add back to the closure of the duct under your arm. It's a good way to remember it. Abduct, adduct. Circumduction is a circular movement which includes the previous movement. A circular movement which includes the previous movement. Circumduction. Flexion, abduction, extension, adduction. Flexion, abduction, extension, adduction. Circumduction. Yeah. Occurs in a few joints, such as the shoulder and the hip joint. Rotation is the movement around the long axis of the bone. Rotation is the movement around the long axis of the bone. This is the long axis of the bone. If I rotate, does it move outside of straight being able to see? Yes. So, the ability for the whole circumference of the joint that's moving to show its size past the actual girth and length and width of the initial longer dominant joint that it's attached to. Medial, medial, rotation, where the anterior surface of the bone faces medially. The anterior surface of the bone faces medially. Lateral rotation, where the anterior surface of the bone faces laterally. The following movements occur in certain joints, such as supination, which is laying flat on your stomach with your head and your whole body laying flat. If you're a stomach sleeper, you sleep in the supination nature. And pronation. that way, occurs only in the forearm, whereas inversion and eversion occur only in the foot. See, it goes front and back. The foot goes up and down. Inversion, eversion. Supination and pronation. Supination is the normal resting position of the forearm where the palm of the hand faces downwards. The radius and the ulna are parallel, and the thumb is lateral. Supination. Pronation is opposite to supination. That is, the palm of the hand faces backwards, and the radius and the ulna are crossed, and the thumb is medial. So you have supination and pronation. Supination. No, that's supination. This is pronation. It's the palm faces backwards. And it's medial instead of just. So when you raise your hand, pronation, supination, pronation, supination. Inversion and eversion. Inversion movement occurs only in the feet. Formula moment. Occurs only in the feet where the plantar surface of the foot faces medially. Eversion is opposite of inversion, where the plantar surface of the foot faces laterally. When you're walking. Swing. Yes. Inversion. Eversion. That has been the Anatomy and Physiology, Anatomical Position, Lesson 1.